Okay, off you go.
Good, thank you. So, welcome to the vaccination session. So in this session, we're going to talk about vaccinations, not only the ones against COVID-19, but also all other vaccines. We're going to go through some of the vaccines that are recommended for lupus patients and which ones should be used by lupus patients and which ones shouldn't. Before we begin this very interesting topic, hello everyone. Next slide, please. Anne-Marie, next slide. Yeah, next slide. Recording in progress. We have some housekeeping rules for you. You need to mute yourselves. Is it better now? No, there's still an echo. Aldevina, Ghislaine, can you mute yourselves? Is it better now? Yes, it is. Great. So, housekeeping rules. Please ensure that your microphone, as you see, is turned off and video as well. Turn your microphone and video on only if you're speaking. Please be aware that this session is recorded. Only use the raise hand function on the bottom middle of your screen if you absolutely need to get our attention during sessions. We will respond in the chat. Please use the chat function to ask any questions or for any comments you may have. Please be patient with us. We will ensure your questions are answered. If you have any technical issues, try logging out from Zoom and logging back in. Next, please. Now, to begin this, we will have a small quiz for you to warm you up. So can you launch the first quiz, Zoe? Oh, maybe Anne needs to do it.
Do I have to stop sharing or not?
No, I don't think you need to stop sharing. Anne, can you?
Quiz one?
Yes, quiz one, exactly. So do you all see it? Now choose an option. Is it safe for lupus patients to get vaccinated? Any vaccine? Yes, all lupus patients can have the same vaccinations as the rest of the population. Not all. Some vaccinations can be dangerous for lupus patients. Lupus patients should never be vaccinated because it's too dangerous. Please select your answer. And as soon as you can see, Anne, that we have some, can you share the
we have 22
poll results? Mm-hmm.
Is that enough?
Yeah, you can share.
Okay, here we go. Share results.
So most of you answered not all. Some vaccinations can be dangerous for lupus patients. And that is the correct answer. So great work. Can you share the quiz number 2, Anne?
I'm going to mute people too.
Yeah, thank you. Okay, I believe all lupus patients should have a COVID-19 vaccine. Yes, lupus patients are at a higher risk from COVID-19 and need to be protected. Not all, only those on immunosuppressive drugs. No, it is too dangerous and we don't know the long-term effects. So please indicate what you think or what you feel. How's it looking, Anne?
22 of 20. It's going pretty quickly.
Okay, we'll just give people a moment.
Okay. 22 of 26. Okay.
Yeah. So, most of you have chosen not all, only those on immunosuppressive drugs. And it might be the right answer. Let's hear it from today's speaker instead. So next slide, please, Anne-Marie. That's too far. Okay, so today's speaker is Professor Marta Mosca. She is a professor of rheumatology at the University of Pisa and head of the Rheumatology unit at the Azienda Ospedaliera Universitaria, Pisana, Italy. I know I didn't pronounce that correctly, but sorry, Marta. At the University of Pisa, Professor Mosca is also the director of fellowship training program in rheumatology. Since December 2016, she is the coordinator of the European Reference Network on Rare and Hereditary Connective and Musculoskeletal Diseases called ReCONNET, promoted by the European Mission. She's also the coordinator of, of the European Commission program Integrate, which aims at integrating the physician and the patient's point of view in SLE. Some of you might have been in that project, very interesting. Professor Mosca is a member of the Scientific Advisory Board of Lupus Europe, and we really appreciate that, Marta. Since November 2019, she is a member of the Systemic Lupus Erythematosus International Collaborating Clinics Group. Professor Mosca has participated in the development of EULAR recommendations for the management of SLE for women's health, for the management of antiphospholipid syndrome in adults, and has coordinated the development of recommendations for monitoring SLE patients in clinical practice and observational studies. She was a member of the EULAR ACR steering committee for the development of classification criteria for SLE. As you can hear, she's a very experienced lady in SLE, and we are so proud to have you with us today. Professor Mosca, the floor is yours.
Dear Jeanette, thank you very much. I'm so
You can stop sharing it, Mike.
Oh, sure. I'm so pleased to be here with you all, and thank you very much for inviting me. It's a pity we cannot be together. I enjoyed already being with you at many conventions, and I would love to be again with you as soon as possible. So thank you for inviting me to give this talk, which is it's a very important subject for us all. And I changed a little bit the title because your idea is the vaccination for people living with lupus, not only COVID, but mostly. Because today, I think this is really one of the most important questions we receive. We have many doubts, and I would like to discuss with you about this as much as possible this afternoon. But also what I like about this presentation is the fact that it's not only COVID. We need to remember what we have to do in treating lupus and in vaccination as well, because it's not only COVID. So we actually have felt during pandemic that sometimes we were not able to treat lupus, and this was really not very good actually. So vaccination, I would say, and rheumatic diseases, not only lupus. Why we discuss about the importance of vaccination? Because we know that in lupus, as in many other rheumatic diseases, the risk of infection is increased. It is increased because of lupus, and it is increased because of the immune suppressive treatment that we use to treat lupus. And the main way to prevent infections is to be vaccinated. Apart from what we have learned from this pandemic, when we stayed home just to avoid the risk of infection, but this is not the way to move on. So vaccination is really the main way to prevent an infection. However, there is an hesitancy on vaccination. And the hesitancy on vaccination, even though there is no hesitancy among you, after what I saw in the questions, from the answers to the questions, is related with many factors. Why? The safety. Whether there is a risk of flare of the disease. Maybe I risk a flare of the disease and my immune system is not going to respond very well. Should I avoid some vaccines and use others? And this, for example, will come for the COVID vaccine. Should I continue my treatment when I receive a vaccination? How can I be sure that I'm protected when I've been vaccinated? And what if there is no antibody response? So the first doubt on vaccination in lupus and many other autoimmune diseases raised from some case reports observed in the literature, where the association of the onset of new autoimmune disease and vaccination was described. Well, I would like to reassure you on the fact that what has been reported in the literature are few case reports. And the fact that I get a vaccination and then I develop a disease, it's only reporting a temporal relation, but it does not support a real association among the two factors. So actually, the general idea is that being vaccinated is not increasing the risk of developing a new autoimmune disease. So if I already have an autoimmune disease, will I develop a new one? Maybe I am predisposed, and this might be a different story. Well, I would be I wouldn't have this issue or this problem because data do not support this association. Should I get vaccination for flu, anti-pneumococcus and anti-meningococcus, which are inactivated vaccines, very important? And very briefly, because actually I will leave much more time of this presentation to COVID, really. These vaccines, which we have been using for decades now, are very safe. In patients with lupus, these types of vaccinations are not associated with an increased incidence of adverse events, nor of disease flares. Some treatments reduce antibody response, for example, high-dose steroids and rituximab, but nonetheless, it is worth being vaccinated with these vaccines against these agents, because these are common infectious agents that might be important and might have an impact on our health, particularly when we take immunosuppressive treatments. So the flu shot should be done every year, and the anti-pneumococcal and anti-meningococcal vaccination should be done as well. Another important vaccine is the HPV vaccine. We know that there is a correlation between the immunosuppressive therapy and HPV infection, and that HPV infection might lead to cancer. So the vaccine is not only a way to avoid the infection, but more than that, may prevent the development of cancer. The vaccine is very well tolerated, and there are many data supporting the fact that in lupus patients, the administration of HPV vaccine is not associated with side effects more than in the general population, nor with disease flares. And the antibody response is good. So this is the fourth vaccine that we should suggest to the patient to take. While are there vaccines which are not advised? For those with immunosuppressive therapy, these are the live vaccines. Live vaccines usually are vaccines against varicella zoster, measles, and rubella. No association with flares have been observed, but if you are on an immunosuppressive therapy, you should not receive this type of vaccination. So this is the very important point. The point is that per se, the vaccine is not contraindicated, but it becomes contraindicated if the patient is on a specific treatment. So the message on the general vaccination for patients with lupus is to consider vaccination, and to consider vaccination particularly in immunosuppressed patients. Only in immunosuppressed patients? Well, I would say no, because flu vaccination, for example, is it's very advised, for example, in the general population above a certain age. And vaccinations are important because we know that lupus is a chronic disease. We might not be on immunosuppressive treatment today, but we might need one in different times. So being vaccinated, it's a good option, and being vaccinated before some vaccine might be contraindicated, as I've shown you with active vaccines, it's very important. So let's think in advance. This led, for example, when we developed recommendations for the management of patients with lupus, to this recommendation, that is that obviously the administration of inactivated vaccines is advised for patients with lupus, preferably when the disease is inactive. So After this very brief overview on the general vaccination and the main message, that is that there are at least 4 vaccines with which we should consider to take on a regular basis and be vaccinated based on the schemes of these vaccinations. Now we move to the COVID vaccine. And what I would like to share with you are the timelines for the development of different vaccines. You can see the timeline for the development of polio vaccine, but you can also see that there are timelines which have not yet ended. There are very severe infections for which we do not have vaccines yet. For example, for SARS-CoV-1 or other inflammatory and other viruses. What happened during this pandemic was incredible, because over a year, more than one vaccine has been developed. So since the recognition of the first case of SARS-CoV-2, of COVID, the genome has been sequenced, and then many researchers have worked on the development of a vaccine very fast. And this very fast development of vaccines has raised many questions. COVID vaccines were approved with an emergency approval, and this is true for all the 4 vaccines we have. And only at the end of August, the Pfizer-BioNTech COVID-19 vaccine has received the full US FDA approval, and the full approval will now arrive for the other vaccines which we have available. So again, this new vaccination has raised the usual questions, but these questions were very strong, very loud, because the vaccines have been developed very fast, and this has led to some doubts. The vaccines I was referring to before are, let's say, old vaccines. And when we've been using something for quite a time, we feel safer. We feel that we've known a lot about the vaccine, about the drug is the same thing. So with something so new in an emergency, some doubts have arisen. The same related, I would say, with the fact that these vaccines were really developed very fast. So are these vaccines safe for everyone, but particularly for patients with lupus and rheumatic diseases? Am I at risk of flares? Again, all the questions I've showed you. I will try to give you some answers to these questions, because what happened during this 1.5 years of pandemic is that we were able, as researchers, as clinicians, to merge our experiences, to discuss very well. With these virtual tools we are using this evening were amazing, and really helped us to share experiences in the treatment of COVID, but also experiences in vaccination. So we are learning very fast, and we have very positive information for us. So fears on COVID vaccines, safety first. Given how quickly these vaccines were developed, how can these vaccines be safe? So first, I would like to tell you that these vaccines were developed very well. All the rules were followed, but something was shortened. What was bureaucracy. I showed you that vaccines were approved with emergency approvals. So it's not the science that is behind the vaccine that has been reduced. The science behind the vaccines was a good one. So which type of vaccines have been used so far, and which type of vaccines I'm referring to when I'm saying whether these vaccines are safe for patients with lupus and rheumatic diseases? All the vaccines have been used, but if we go to the EULAR COVAX registry, we can see that in the majority of cases, the patients were vaccinated with the Pfizer vaccine, 78% of patients. But also 16% of patients received AstraZeneca, and a lower percentage of patients Moderna vaccines. Data on J&J are available as well. And we have good news. Patients with rheumatic diseases and lupus have experienced the same mild side effects as the general population. And there are no safety signals which might be attributable to the underlying conditions in patients, in our patients. So expect what I could expect, what my daughters could expect if vaccinated. What are these mild side effects? Well, these are observed within 2 to 7 days from vaccination in up to 50% of patients: fatigue, headache, muscle and joint pain. Very rarely, very few cases of anaphylaxis. But again, you know, I have to tell you that we expect side effects from vaccines. So it's not a null effect. Nothing has a null effect. We expect side effects from treatment, and we know that vaccines might give side effects. The important message is that these side effects are not increased and not more severe among patients with lupus. There are local reactions, and these are really very mild reactions. And even this data, specific actually for the Pfizer vaccine, confirms that the most frequent complaints are fatigue, headache, and muscle pain and joint pain. Is there a risk of flare? Because the side effect is not only really the one related with the vaccination. A side effect might be a flare of disease activity. And again, the messages are very good. The majority of the cohort studies do not report disease flares after vaccination. There have been some patient surveys, and maybe some of you have participated to these surveys. And in surveys, flares have been reported in up to 13% of cases, but only 5% requiring changes in treatment. Now, these data need to be analyzed because we know that lupus can flare. So we really do not know if this flaring is more than expected. And I think that additional analysis of this data will give us this information. So at this stage, we cannot say that vaccination is increasing the risk of flares. We have observed also in our experience, in my experience, we have observed few flares. But again, we are used to observe flares of the disease, unfortunately. We know that with the current treatments of lupus, you still face flares. So we really need to understand this a little bit more. But again, I think the message is positive. We shouldn't be worried about this. In patients with very active disease, vaccination has been postponed. But there are now recommendations telling us that we can vaccinate also patients with mild disease activity, because the advantage of being vaccinated against a potentially very severe infection is really, really high. So if I get vaccinated, but I'm on immune suppressive treatment, prove that I might have some side effects, will I have a protection against the virus if I'm taking some treatments? Well, I anticipated already to you that immune suppressive treatments may impact on the efficacy of vaccination. When we measure the result of a vaccination, for example, by the ability of the immune system to produce the antibodies, we know that if a patient is on high dose of steroids, on rituximab, for example, but also methotrexate, this amount of antibodies might be reduced. This we know from the old vaccinations, and we may expect that this will happen with COVID vaccination as well. And in fact, now we have data showing that indeed the response to the vaccine is very good. Patients with rheumatic and musculoskeletal diseases develop antibodies, but 80% of patients versus 100% of general population. And why is it so? Is it related to the disease? No, it is related with the treatment. And so here you can see some of the treatments which are used for lupus that may impact on the response to the vaccine. As I anticipated, rituximab, but also mycophenolate and also methotrexate. So here again, this study is reinforcing the fact that some treatment are associated with a reduced response to vaccine. But if you go here to lupus, for example, you see that there is a seropositivity, so a response to the vaccine very high, 92% of patients. So my perception and the data suggest that it is not the disease, but it is the treatment. And what has been shown is that after the first dose, patients with rheumatic diseases do not respond as the general population, but there is a seroconversion after the second dose. So this is very important, and it was very important when the vaccination started. You know that when the vaccination started, sometimes the interval between the two doses was prolonged a little bit. So this is not advisable for patients who are on an immunosuppressive treatment, because the response to the first dose is not really the best one, but it is very good after the second one. And I can move now just to a consideration on the third dose, the boost dose that we may want to discuss a little bit. This might suggest that after a boost dose, a booster dose, the response might increase as well. So here we can see again a specific study in patients with lupus and rheumatoid arthritis, and we can see again that some treatments impact on the response to vaccination. Here you can see patients with lupus, and you can see patients with rheumatoid arthritis. And you must know that rituximab is not only used in lupus, but it is used also in patients with rheumatoid arthritis. But I would like to give you another important message. We always say, oh, I received my vaccination, but my antibody titer is low. It is not only an antibody titer, because the immune system works in different ways. So we know that we have antibodies against the infections, but is also cells, is also the so-called T cells. So there are data telling us that even if the response and the antibody titer might be reduced, there may be a good response with T cells. So we shouldn't be too, focus too much on antibody titers, even though this is the only way we have now in real life to measure something, some type of response to the vaccination. So the immune system works in protecting us in many ways. So be aware of this and not to be worried too much if the response and the antibodies are not as high as you would like to see. And it's not only the titer of antibodies, it is also the ability of these antibodies to act against the virus. Here I'm showing you some data from our cohort, a study which has been submitted for publication. You don't need to read it. I'm just reassuming the fact that what we have done was to measure offshore the antibodies, but also to see if these antibodies were good ones, had a good high avidity. And we observed, and this is very, very positive for you, that our patients produced high avidity antibodies after the second dose as healthy controls. So this is another very important message. Antibodies might be low, but might be very able to protect us. Obviously, the ability of a vaccine to work depends on the ability to prevent the infection. And we have very, very little data on this. But the EULAR registry is recording reinfection in vaccinated patients. Here you can see that few reinfections have been reported, mainly in patients which were partially vaccinated, patients who were on immunosuppressive treatments, but the majority of these patients recovered very well from the infection. But on this, we need additional data. These data are data on patients with lupus, specific patients with lupus, and you can see again that the use of immunosuppressive drugs and prednisone was associated with a decrease in vaccine response. So a booster vaccination is needed? Well, I think that the answer is yes. The VACOLU, which is a survey that was run among patients vaccinated, was aimed at, and I'm putting this now because it resumes a little bit from the voice of patients what happened with vaccination. And here you can see that with the VACOLUP report, 571 patients with lupus were vaccinated. 46% had minor side effects, and as well after the first and the second infection, but very, very few patients had flares and no cases of COVID-19 were reported. So it looks like the vaccine is protecting us. So I have lupus and I've heard so many things about COVID vaccine, about, for example, thrombosis in some patients, in some subjects, thrombotic risk. Is there a vaccine I should prefer? We have no data so far telling us that we should prefer one vaccine over the other. But since some vaccines have been associated and have as side effects the risk of thrombosis based on the patient history, we should consider this risk before saying that anyone could receive any vaccination. So as a physician, I will analyze whether my patient had a thrombosis, has antiphospholipid antibodies, and I would balance the advantages and the risk and decide whether I should advise one vaccine over the other. So it's not possible to generalize because up to now, we do not have enough data, but from the few percentage of patients with rheumatic diseases who have received, for example, those vaccines associated with thrombosis, no safety signals have been reported. And in fact, based on this, the American College of Rheumatology guideline tells us that patients should receive any vaccination based on the FDA or EMA approval, and even patients with active disease. The only situation in which maybe vaccination should be postponed is a very severe flare. So what do we know? That all the vaccines can be administered to patients with lupus, caveat with thrombosis, and an analysis based on the specific clinical history of the patients. There are no data comparing all the available vaccines, and this is what we will have in the future. AstraZeneca vaccine may be associated with blood clots, so this is a special attention that we physicians know. So we need to think a little bit about this, but more data are needed. So if the treatment impairs the efficacy of the vaccination, should I discontinue treatment during vaccination? We know that the treatments are all the treatment we use to treat lupus. No. I think that based on the data we have, we should not stop and discontinue treatment. We should not delay treatment to vaccinate a patient. When we think about rheumatoid arthritis, which may enter a stable remission, we may think about stopping treatment maybe for a week or 2 weeks after vaccination. But for lupus, I think it's not wise to think about stopping treatment because we know that we have a risk of flare. So maybe very stable cases, patients in very strong remission, but please discuss this with your physician. Do not stop treatment while you will be vaccinated because there is a risk of flares. What I can tell you is that from the COVID, we have learned that some patients during COVID, because they were afraid of getting COVID, stopped their treatment, and this led to disease flares. So since the vaccination takes time, because we know we have to take 2 doses apart, 4 weeks apart, and maybe a third dose, another 4 weeks apart, we cannot stop treatment like this because there is a risk of flare. So please, my message on this is discuss this with your doctor. Since now we are thinking about giving you a boost. So it might be more dangerous stopping treatment. When in ReCONNET, we have met twice to discuss about vaccination in rheumatic diseases. And when we discussed this, we asked to our members whether they were stopping treatment. And these are the answers. So more than half of us, and this happened in March, April, were not keen in stopping treatment. And consider the yes really is very for a short time. But this is just to share with you thoughts and ideas we had, but basically, please continue your treatment and discuss this with your doctor. Should we do the antibody and be worried if we have a low titer of antibody? Well, there is no proven data telling us that if we have a low titer, we are not protected against the virus. But even though we do not have the idea, we still use a little bit this. Even if we are giving a boost without measuring antibodies now. So it's kind of a tricky thing. I have a low titer, am I protected or not? We are not really in the position of giving a strong answer. So this is the big question. Should I receive a third dose? And my answer now is yes, is the answer from the healthcare system in Italy. The immune-compromised patients are receiving now a boost dose, which is really a booster dose. So if those who are starting vaccination now are receiving 3 doses, not 2. Our experience in Pisa, we have a study, and I will show you very briefly this study. This in patients with lupus, and out of 86 patients who have been vaccinated, you can see the majority have received either Pfizer or Moderna vaccination. We had very, very mild adverse events as the general population. And as I anticipated to you, 3 flares, 3 patients flared, but no de novo manifestations, polyarthritis, arthralgias, and polychondritis. Was this due to vaccination? Really, I can't tell you. So to conclude, we have very positive data on vaccination, generally speaking. Patients with lupus should get vaccines. Do not forget your flu shot now that we are entering in autumn, because we will have flu vaccination. So get your flu shot. Consider the other vaccination and discuss with your doctor about your vaccination status and not be worried to be vaccinated against COVID-19. Adaptation of treatment might be done, but shouldn't be done if not discussed with your doctor, and you shouldn't be worried about being vaccinated while on immune suppressive treatments. Rituximab may impact on the vaccination results, and this actually might be the only treatment that should be a little bit aligned with vaccination, but not mycophenolate, not azathioprine, nor the other treatments. And the third dose of vaccines will be considered. Just to tell you that we have a rich research agenda, because it's not just today. We think that COVID is among us, and we need to know many things about vaccinations, because we actually, what I told you about vaccines and pneumococcus and meningitis, I've learned over the years. And over the next years, we will learn more about COVID and about COVID vaccination. So just to tell you that we are involved into this with you as well as ReCONNET. We are running a study that is called Vaccinate study. It is a study involving experts in rare diseases and lupus as well. And we are collecting data on safety, on efficacy of vaccination, on differences among different vaccines, because we would like to be able to tell you which is the best vaccine for you and whether this vaccine is going to protect you. So we are also assessing COVID-19 incidence among vaccinated patients. It will take time to have data. We will open the first analysis in October. So you will find this information either in ReCONNET or in Lupus Europe websites, and we will share. I will be happy to share this information with you. So now I have time as much as you want to discuss with you, and I would like to thank you for your attention.
Thank you so much, Marta. Really great presentation, and you went through a lot of the things I think people were asking themselves. I'm trying to collect questions from the chat, and I think we have a lot to talk about.
Yes,
so I think yeah, some of them you already touched upon, but I will ask them anyway because they might have a different angle on them.
Yes.
So I just need to be able to see my chat. So Petra's asking, saying hello, good evening. Is there a time limit between vaccinations? For instance, I'd like to get my HPV vaccine. Sorry.
Yes.
Okay. Yeah. I was vaccinated with mRNA Moderna vaccine in June.
So the advice for everyone is to wait a month since the last one you got. So I would tell you that this is the length to wait, as it has been advised also to the general population. So I would wait a month.
Okay, thank you. That's clear. So Francesca's asking is, if there's no response with the first 2 doses, is there any possibilities that a third will generate a response? I know we don't know yet, but do you have a guess?
Francesca, yes, I feel so. One thing that I was thinking is whether, it's not only antibody response, it's also T-cell response, but we cannot assess T-cell response now. So since we cannot, I've been thinking about this because we have patients who actually do not have antibodies. So actually my point was whether we should revaccinate completely with 4 doses, so another 2. Let's restart. This I do not know. This I do not know. So this is something we need to learn.
Yeah, interesting. Would be very interesting to see if that would be an option. Yeah. So Gillia's asking, for those patients who have had a COVID infection and received 2 doses of vaccine, should they receive a 3rd dose?
So if you already received 2 doses, the reason is probably because the interval between COVID and vaccination was very long. So it was felt that you deserved a complete vaccination. It depends on the treatment you are on. And I would say so, because if you're on immunosuppressive treatment and the decision to revaccinate completely, then probably is as if COVID doesn't matter now. So this didn't happen to me. So this is something, again, I would have to think about, because the case I had, for example, is a patient, she had COVID, so she received only 1 shot. So I reprogrammed her for the 2nd boost now, because now that she's on belimumab and now I feel that maybe she should have been vaccinated completely, even though she had COVID. But these are very interesting questions you're making. And I have to admit that it's food for thoughts for me, because all these situations are new. So it's even difficult to tell you yes or no, I'm sure, because I'm not.
Yeah. We're learning as we go along, and
yes.
you do it as well as physicians.
Yes.
So, but it just shows how good an audience we have, that they ask so interesting questions.
Yes. Julia, I would tell you, and I would tell you something that is against what the recommendations say and what I've already told you, that probably I would go for the antibodies in this case. And if antibodies are so high, probably not, but nothing is supporting what I'm telling you. So it's just to find something to have a support.
Yeah. Well, thank you. Your guess is better than many of the other people I know. So thank you. So Leslie is asking, is it recommended to receive the same type of vaccine for the booster as was received with the first 2 doses?
So Leslie, the phrasing recommendation is a very strong one, because recommendation is usually based on data, which we do not have. What I can tell you is that here they are reboosting with the same vaccine, from what I know. But again, mRNA vaccines, I mean, they've done their job a few months ago. So I wouldn't see any reason for not receiving, if you've received one mRNA and you receive the other one, I would not see the reason why not, okay? So for the viral vector vaccines, again, for example, in Italy, they're not administering these vaccines to young people because of the clots. So I don't have this problem, let's say, with the different type of vaccination. So from what I've read, I don't see a problem of changing between the two mRNA. But also I can tell you that during COVID, the first round of COVID vaccination in the general population, there have been subjects who have received the first dose of AstraZeneca and then the Pfizer as a second dose, and nothing happened. So I think that I cannot tell you whether it's recommended, but I think it can be done. So I would follow the EMA, FDA, and local authorities' indications on that.
Yeah, okay, thank you. Yeah, it can be difficult. So Ines has a question where I'm just going to see if I know what you're asking, Ines. So Portugal is going to vaccinate the immunosuppressed with a third dose, and she already received her invitation. But in the fall, she always takes the flu shot. So and she also has the invitation. So what should you do?
Ines, again, my suggestion is always in these situations, since I've shown you that there are no specific issues for patients with lupus and connective tissue diseases, to follow the indication that we receive from the health authorities. I have to tell you, I'm not an expert in viruses. I'm not an expert in vaccines, and I'm not telling anything. I mean, I'm not a virologist, okay? So I don't want to take their job. I tell you what I do as a doctor and what I read and study, because I need to be sure and to have information for my patients. So my first message is, on these issues and these questions, we have experts. They are really assessing these, and we should follow their advice. Again, as we discussed, usually it's a month. So, but they might come out telling us that we can take both. I would tell you wait a month because we are wearing masks, so it's unlikely we take flu. But I mean, you are receiving the shot now, and the flu vaccine, I think, will be available in November, December. So we have time to do this.
Okay. So go ahead and get the COVID vaccination, and then wait a month and have the other.
Yes. This would be my advice for my patients now. But I mean, someone can say, no, it's not correct. And I could change the advice based on the data.
Yeah, but you do know a lot about lupus patients, so I would trust your advice. So Lucy is asking, is it just patients on immunosuppressive medication that need a booster, or all lupus patients regardless of medication?
At present, we are boosting only patients on immunosuppressive medications, based on the assumption that we have observed that patients on immunosuppressive treatments may respond less well to the vaccination. So it is not, patients on Plaquenil are not included, okay? If you are on below 20 milligrams of steroids, it is not included. So let's say maintenance of methylprednisolone 4 milligrams, not now. Obviously, our patients are fragile. So I believe that after this the revaccination, maybe one boost, which is the one I will receive as well, all the general population probably will receive one, probably patients with vaccination.
Okay. After 2 doses, what is the specific period recommended to measure the antibodies created after the 3rd dose? I know you can't answer it, but
no. I've done this because these are the questions I make to myself, and even when I prepare this presentation and I read all these are the questions I would like to have an answer to. And these are beautiful questions, very specific, very, very clear, and very, I mean, there is never a right or wrong questions, but these are the questions. So, there is no specific period because we should not measure the antibodies on a way. On the other way, how can I be sure that 3 doses are enough? So you are right, Stalo, and I do not know. I do not know what to tell you. Based on how the immune system responds and what we have seen between the first and the second dose, after 4 weeks, we should see whether you have responded. But there is no time. So, for example, in our study, what we have done was to measure the antibodies when the patient was coming to the clinic to receive the second dose, because this is what we have done. So we know data after 4 weeks.
Yeah, okay. Yeah, I'm afraid this one is another difficult question. Blanca is asking, in the Spanish health strategy, only patients with anti-CD20 treatment will receive the 3rd dose, not with immunosuppressive treatments only transplanted patients. And she asks why.
Well, I don't know why. For sure, anti-CD20 treatment is the one with the major impact on the ability of produce antibodies. So for sure, this is the treatment for which we know that it is difficult to respond to vaccination, any vaccination, not only COVID, flu and whatever, HPV, whatever, any vaccination, because the treatment per se is going against B cells. So the cells producing antibodies. So I think that the reason is that with anti-CD20 treatment, there is reasonable certainty that the response to the vaccine was not a good one. Why they are not enlarging to all the other patients, I don't know.
No, you can't answer it unless you are in the Spanish health authorities, and we're not. Okay, so Juan Carlos is asking, has there been studies if it's good to have the flu, the COVID flu and the COVID vaccines 3rd dose at the same time?
No studies. I'm sorry about this. And this is an issue we will have really in a month's time. Yes.
And Francesca is telling us she will let us know if she has a response on the 3rd dose. Thank you.
Yes, Francesca, we are collecting this data because now or next week we are vaccinating our patients. And for those who live nearby, we are asking them whether they can come back to the clinic so that we can measure at least the antibodies, even though this is not what the recommendations tell us.
Yeah, okay. Anne is asking, what about mixing vaccines? Only Pfizer is approved for the 3rd dose, but not everyone has had that vaccine. So if you had a different one for the first 2 and then Pfizer, it's more or less the same question as we had before.
Yes. Vaccines have been mixed already. And so we have to move on with what we have now.
Yeah. So Magdalena, it's more on the same arrow. It's which type of vaccine should we take as a 3rd dose if you have a choice? Does it have to be the same kind of vaccine that we had before? So Moderna, or Pfizer, or
let's see what the companies and the EMA, FDA tell us. Because as I read, and as I said, mixing has already happened. So we will see.
Yeah. So Michaela is asking, could lupus patients who did not have an immune response to vaccination and got affected be treated with monoclonal antibodies?
Well, I think that this is a good option, and I leave this to the virologist, the expert in infectious diseases, but I guess that they will, as it has been with transplanted patients and with some patients as well during COVID. Yes. So the decision on the treatment for COVID, it's really for those who are the COVID doctors.
Yeah. This is the last question because we're running out of time, unfortunately. It's been really interesting, Marta. But Zoe is asking, if a lupus patient is on immunosuppressant and has a very high antibodies post-COVID vaccination, are they protected against severe infection?
This is what we expect from vaccination. Not to be really, we could get COVID as we can get flu, but the vaccination should protect us as against the severe infection. So this is what we hope will happen, because when this will happen, if this will happen, and it looks like this is happening, this will transform COVID from a very severe condition into something we can live with, because COVID is among us now. And so I think that with this message, that's what we are looking and hoping and seeing, I think this is the main message, that COVID will change and we will gain back our lives.
Yeah. Thank you so much, Marta. We all hope that we can gain back our lives and go out into society without fearing COVID all the time.
Yes, it's true. It's true.
So unfortunately, we need to move on. So I don't know if Zoe is able to launch the exercises, because we need to move now before we go to breakout rooms. Yay! Looks like it.